cartels from Afghanistan are believed to be targeting South Africa as a new destination. This is according to the latest report from the Global Initiative Against Transnational Organised Crime. According to the report, the syndicates are using Mozambique to ship hundreds of kilograms of crystal meth to South Africa. Let's get more on this from Shaun, Shelly from the South African Network of People Who Use Drugs. A very good morning to you, Shaun. Clearly this is a disturbing development when it comes to access to drugs in South Africa. How bad is it?
Well, I think the real question is how big is the demand in South Africa for these particular drugs? Because nobody's going to be supplying them if there isn't a demand. And there's clearly a demand that's created by a lot of socioeconomic conditions and a lot of lived conditions of people who happen to use drugs in South Africa. So we're seeing an increase in the use of crystal meth at the moment. And
Afghanistan has taken over from Iran when it comes to crystal meth. The quality, I believe, is really good. I mean, that'll pose another problem, won't it, when it comes to addiction and what to do with that?
Well, yeah, we're not certain what the difference in the quality is. It's reported to be better, but we're not certain about that. The one good thing is that in terms of crystal meth, there haven't been a lot of impurities in the drug, which are the things that usually cause the most harm for people in other drugs, such as heroin and cocaine and that. But it's a much more pure drug. So that's probably something that's going to cause less harm. But obviously, when you've got a drug like this that's available freely and people are using it, there are going to be consequences to that if it's used in too much quantity or greater quantities.
Yes, tell us about the dangers of crystal meth and why people use it.
Well, people use it because it keeps you awake, it sharpens your mental abilities temporarily, it makes people feel as if they've got a lot of purpose and a lot going on in life. It's a very motivational kind of drug. But the problem is that we don't really know what dose people are taking when they take it recreationally or as something outside the medical setting, and often it leads to not sleeping for many days, and sleep deprivation is a serious problem for people. It also means that people aren't eating as much, they're not getting the right nutrition, and also once you've stayed awake for a few days, things like psychosis and mental health conditions really start kicking in and causing problems.
All right, so how do we tackle this? And tell us a little bit more about the supply chain, if it's coming from Afghanistan and apparently through Mozambique. I mean, that I should imagine is one of the biggest problems for South Africa, is how porous our borders are.
Well, yes, our borders are porous, but so are the borders in most countries. You can't actually stop the international drug trade just by closing down borders. Nobody's ever been able to do that. In the one or two cases where they have done it for a limited period of time, it hasn't stopped people from using drugs. In the Ukraine, for example, people then just started synthesizing their own versions of heroin using codeine-based medicine, and that led to an even more dangerous drug. So the answer isn't just closing down the borders. The answer is really to address the issues of demand for the drug. And that's really a whole lot of socioeconomic issues that need to be addressed, a lot of educational issues, and for people to be able to find alternative purpose and meaning in their lives and live in an environment where drugs don't become the most important thing in their life.
Right, so as you say, tackle it at the grassroots. But how big a problem is drug abuse in South Africa? I mean, do you have any idea of how many people are using and what's the biggest drug that is being abused or the most common?
Well, alcohol is the biggest drug that's being abused in South Africa. That's probably our number one problem. And of course, that's not a drug that people are criminalized for using. Other drugs that are emerging, heroin, niope, unga, wunga, they're all heroin based. And methamphetamine is also being used quite extensively these days and increasingly so. In terms of the routes and the trade routes, we're not 100% sure that this is an established and ongoing trade route that comes down from Afghanistan. That's based on a lot of conjecture and a lot of anecdote that's being told at the moment, but further research is being done. In terms of the numbers, nobody really knows how many people are using drugs in South Africa, and that's one of the gaps we're hoping to address through various mechanisms. We need more data on it and we need more research on it.
Good to talk to you, Shaun. Shelly, thank you.
Thank you very much.